Today we will discuss about the cyanide and carbon monoxide poisoning. Before moving toward this topic, first we should shortly discuss the hemoglobin. Hemoglobin is consist of the four polypeptide chains, 2 alpha and 2 beta. These four chains further consist of the heme portion and the globin portion. Basically, the heme portion contain iron in the reduced form, which binds with carbon monoxide and oxygen as well. Second thing is, when this reduced form of the iron oxidized to the ferric form, then this is not able to bind with O2 and carbon monoxide. Then its affinity increase with cyanide binding. Second thing, this when iron is oxidized form in hemoglobin, then this condition is called methemoglobinemia. And methemoglobinemia is variety of causes. We divided the causes into the congenital and acquired causes. The most common cause, congenital cause of the methemoglobinemia is cytochrome B5 reductase deficiency, and acquired causes include dapsone, local anesthetics, and nitrate toxicity. Second thing is, the second portion is a globin portion. Globin portion of the hemoglobin is responsible for the binding of the CO2 for hemoglobin. Affinity of hemoglobin for carbon monoxide is 200 times its affinity than for oxygen. Second thing, when carbon monoxide bind with hemoglobin, it increases the affinity of remaining site for O2, causing the oxygen dissociation curve to the left side, leading to the decreased delivery of the peripheral tissue of oxygen for metabolism. Carbon monoxide and cyanide both inhibit the complex 4 of the electron transport chain, which lead to the decreased aerobic metabolism, which ultimately cause the metabolic acidosis. Second important thing, carbon monoxide bind to the ferrous of the heme portion, which is the binding site of oxygen as well. Second thing, cyanide can bind only the ferric form of the iron. Carbon monoxide change the oxygen dissociation curve to the left side, which mean that when carbon monoxide bind with the hemoglobin, then it increase the affinity of the remaining site of the hemoglobin for oxygen. Second thing, carbon monoxide compete with the binding site of the hemoglobin for oxygen. Oxygen dissociation curve in case of the cyanide poisoning is normal. Carbon monoxide also lead lactic acidosis. Cyanide also lead lactic acidosis or metabolic acidosis. But carbon monoxide, another thing is another finding is carboxyhemoglobin. Fifth point is the bilateral globus pallidus lesion on MRI seen in carbon monoxide poisoning, and this thing is rarely seen in cyanide toxicity. The partial arterial pressure of the oxygen in both cases, carbon monoxide and cyanide poisoning, remains same because oxygen partial pressure is basically due to the dissolved oxygen in the blood. Carbon monoxide poisoning is treated with 100% oxygen and hyperbaric oxygen if needed. Cyanide poisoning is treated with hydroxycobalamin, nitrate, and sodium thiosulfate. Basically, hydroxycobalamin bind with the cyanides, lead to the increased cyanocobalamin formation, which is easily excreted by the kidneys. Second is the nitrate. Nitrite basically oxidize the ferrous form of the hemoglobin into the ferric form. Ferric form has a high affinity for cyanide binding, which decrease the toxicity of the cyanide. Third is the sodium thiosulfate. Sodium thiosulfate causes increased conversion of cyanide to the thiocyanide, which is also easily excreted by the kidney. Fourth is a decontamination, removing the clothing of the patient.